Hello, my name is June Gante. I have Lailani here as my client for today. She complains about the lower body back pain and stiffness. Um, so Lailani, based on your complaint, I'm planning to assess your spine and your pelvis by gently, like soft touch. Um, Most clients feel looser and after the session feel they improve their circulation and good sleep. And whereas sometimes also on the other result for this is you might have feel pain, just like you're after going to the gym, you feel pain, stuff like that. So I'm gonna. Is there anything that you don't want to?
Just maybe just not my just
Your,
my neck. Just
your neck.
avoid that one. But like yeah, everything is
Okay. So you're comfortable with me proceeding with the procedure? Okay. So great. We're gonna do the assessment. I'm just gonna look for some side bending and rotation here. Keep your straight. Everything is good so far. Now tilt your head and crouch back. Okay, now extend. It's good. Right. Now I'm gonna check the lever of your pelvis. Can you raise this one, please, so we can check this size? Right. So this one. Okay. So on this side, you're gently, like you're slightly forward. I'm gonna check this one just to confirm one. Right. I'll check your level of your ilium as well. Seems pretty good. Now I'm gonna have you sitting down. Oh, sorry. You have to stand up first. I'm gonna check again your deep sulcus here. Now cross your arms and then gently pull forward. Okay. You have a left up sleep, but I'm gonna confirm that when you're sitting here. Okay. Use your elbow against your quads. Move forward. So right now, I'm gonna have you lie down on your back. So first, I'm gonna have you locate your um, pubic tubercle for me, please. It's pretty much level. That's good. And then I'm gonna check here. pretty much the same. Now I'm gonna put this one on you just for my sweat gland check, and you can roll over so we can, yeah, on your chest. Sorry for the awkward one. Okay, just go down farther here. Yeah, that's good. So just relax. Yeah, neutral position there. I'm just gonna do some spine check here. Pretty consistent, eh? You have deep sulcus on your left. So are you okay if I work here in between your legs here? Okay. I'm just gonna check your ILA here. So what I found here is that you have your your left ILA is much lower than the right one. So can you raise your body like your trunk, extend your back, your trunk, yeah, for me? Okay, level down now. So I can go down now. Just relax. While you are on this position, I'm gonna do some my thermodiagnostic test. Yeah, yeah. Yeah, I can feel some heat over here, but I'm gonna confirm that when you're in supine. So before that, I can take the. Okay, it's all good. So you can roll over now, and
Then I
we
have
can
to
move.
stay.
Yeah, move forward. Seems pretty hot in here. That means there is like a increase in arterial flow on that side. So it kind of confirmed to what I'm thinking right now about the problem that you are having. So I'm just gonna proceed with the process here by doing passive range of motion as my functional assessment. So first of all, I'm gonna extend this one, your hip. I'm just gonna flex this one, extend it. Do you feel any tightness of this movement? No? Sorry, I forget this one. All right. Can you sit down for now, Leilani? I'm gonna do some reflex on here. You okay?
Yep.
All right. Now my next thing to do is because I'm kind of have a hint of what's going on right now. So we're gonna check if you have a ligament laxity on your on your SI joint.
Mhm.
Okay, so I want you to lie down on your back right now.
My back.
So I'm gonna check if you have some like labored effort raising this either of this leg. So I want you to raise this leg, the right one, and I want to feel if you are having like exerting an extra effort on that. Can you raise your right leg now?
Like how far?
You can like 30%, something
Okay.
like that. That's okay. And then this one. All right. Seems to be this one is a little tight, eh?
Mhm.
Now I'm gonna press between this one and we'll
Mhm.
see if it's easier for you or not. Okay, raise your right leg. And the other leg. Do you feel it's easier?
Mhm.
Okay. So we cannot conclude yet that if it's a laxity of your ligaments. I wanna rule out if there's any muscle imbalance in there. So what I'm gonna do now, I'm gonna put pressure on this one, and you raise the opposite leg. Okay.
Okay. Raise now?
Yeah, raise against my. You
Oh,
have
this
to,
one.
yeah. So against my resistance also with this one, and then the other one. Press this one. Okay. So the first one was the easier one, right?
Mhm.
Okay. So it's you have a laxity on your ligament. So it's confirmed that Leilani has a laxity in his SI joint, but it's not the final um, the final thing that we're gonna do yet. So I'm gonna start with the treatment right now. Um, I'm gonna do the GOT. Yeah, GOT as your treatment for now. You okay? So if you notice, we had you were slightly um, in our assessment earlier. Your hip on your left or your knee was having a slight inflare. So you by pressing this one, you're gonna resist. Yeah. So you can like twist your leg towards me. I mean, 10 10% of your effort for 10 seconds. Okay. Go. One, two, and then rest. Then again. Then again. And then do the opposite side. You go against my resistance. Okay. Then go ahead. And again. Same as this one too. Okay. Another one. All right. Go that way. 10. Rest. One more. Okay. So I'm gonna reassess if we still have an in flare here. It's pretty much the same now. And for your ligament laxity, what I'm trying to treat right now is I'm gonna some passive adjustment. So just relax yourself, and I'm gonna passively bring this one towards me. Do you feel the?
Mhm.
Can you stand up now, like Leilani, and we'll check if you're still having that upset. Okay, slowly bend forward now. That's good. One more. Okay, we fixed that part. Now we're gonna do your sacral, the sacral rotation. So I want you to go prone, and then we'll do the correction. So what I'm gonna start doing now, yeah, just relax yourself there with your both hands on your forehead. So I'm gonna open your SI joint here, and then the next one, and then turn your head to your left. Okay, I want you to breathe through my hand. Okay. Inhale, 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 and then exhale, exhale, exhale. Inhale, inhale, and then exhale, exhale. One more. Inhale, inhale, and then exhale. Okay, put do your you can put your head to back to neutral now. Okay, extend your trunk now, and it's level. Yeah, it's level in neutral, and it also level when you go to extension. So you can sit down now, so we can. So what happened is that your your sacrum is uh, your sacrum is connected to your SI joint, right? So it's kind of stuck in there. So when you move your body, it goes up. So that makes your up slip there. And then we did that correction. Um, all this thing that you feel with your back is just like a reflexive pain from that part. It goes either on your QLs or your glute glute muscles. So what I'm gonna recommend now is at work or when you are driving, um, set your chair or set your hip should be lower than your knees, so that you saw us like there's a downward load of your psoas. And then for now, what I can recommend is, since you're a busy person, just go for a relaxation massage. That's what I'm thinking. And then I'll see you on
Perfect.
the next one.